Hello, future healthcare heroes. This is Nurse Ed Scholar. Today, we're going to dive into the respiratory assessment. Now, when we begin with collecting subjective data during the respiratory assessment, we're going to ask our client about cough, sputum, shortness of breath, chest pain. You're going to ask them about their smoking history if they're a smoker, how many years, how many packs a day. So there's this calculation, the in pack years. So what's your smoking history in pack years? So the number of packs per day times the number of years smoked. Okay, so that'll give your smoking history. You'll ask about any dyspnea. You're going to ask about environmental exposures. Um, are they exposed to, pollution or chemicals? What medications they're taking. You're going to further ask more questions when it comes to the respiratory assessment. Have they had any infectious respiratory diseases like pneumonia or the flu or COVID-19? You know, have they recently traveled? When was their last tuberculosis test? Their last TB test? Have they been experiencing cough, shortness of breath? I'm repeating this again because this is important. Um, Fatigue, body aches, headache, new loss of taste or smell. You heard that a lot with COVID. Sore throat, congestion, runny nose. Are they even having nausea, vomiting, and diarrhea? Are they having fever and chills? One thing I didn't say, you're going to ask them, um, did they have any vaccinations? Did they have the flu shot? Did they have the pneumonia shot? If they're older than 55. Um, did they have a COVID-19 vaccination? Okay. So that's a lot of information to gather, your subjective data. Now, when you move on to objective data, you're going to perform this through, you're going to inspect them, inspect their body, palpate, percuss, and definitely auscultate. When you're inspecting the patient's chest, you're looking at their skin color, the shape of the chest, because you remember in class y'all are gonna talk about, barrel chest. So what's the shape, the configuration of the chest? You're going to palpate the chest for tenderness. You're going to determine lung resonance through percussion. Now, we don't typically percuss, but sometimes you're taught this, okay? Also, you're going to look for on palpation for lumps or lesions, um, skin temperature, the moisture of the skin, masses. So there's a lot going into this inspection and this palpation. And then when you auscultate your patient, you're listening for the breath sounds, the normal breath sounds, those vesicular, those bronchovesicular, those bronchial, all of that's normal. And remember that when you auscultate, you don't want to, listen over the scapula. You don't want to listen over breast tissue. Okay. So remember to avoid those areas. Now, also when we auscultate, we'll use the stethoscope's diaphragm, listening very closely. You're going to start from the apex uh, to the base. We talked about those normal breath sounds, but then also you want to make sure that you know what normal is. Because when something is abnormal and those are your adventitious breath sounds, you really have to be able to distinguish which one they are. The patient may have crackles or another name is rales. They may have wheezing. They may have rhonchi. And understand and remember with rhonchi, if you cough and it clears, then, well, not you, but if you ask the patient to cough and it clears when you listen again, then more than likely that was rhonchi. Okay. Let's move on to teaching. When you teach your client, you want to discuss specific aspects about the respiratory health. A lot of the things that you ask for that subjective data, you're going to encourage your client to steer away from those things, environmental hazards, pollution, chemical exposure, especially with smoking. You know, uh, you're going to promote smoking cessation programs. You're going to stress the importance of periodic examinations for those smokers or those who have a history of chronic respiratory illnesses, those chest x-rays. You're going to encourage them to get those tuberculosis skin tests. You're going to encourage them to get those vaccinations, the influenza, the pneumonia vaccination. You're going to definitely have your patients be proactive in following up with their primary care providers, especially if they're experiencing any persistent cough, shortness of breath, or any other respiratory system. Okay, because we have to empower our patients to take charge of their well being. So that was it for the brief overview of the respiratory assessment. I'm trying to give you all of the nuggets that you need that will help with testing and documentation. So please, continue to work on learning uh, the questions that you're asked, the auscultation techniques, the patient education that you're going to um, encourage your patient on following, because all of that, you as a nurse will make an impact on your patient's health. Okay. So remember to hone in on these skills. Remember to practice because, with the respiratory assessment, every breath counts. Okay. So best of luck on your nursing journey. Please like and subscribe if you like this. And I'll see you next time.